Bowflex comes in a 10 and a 15 centimeter.
Yes.
Any thoughts on which ones to use in the aneurysm versus dissection?
In acute dissection, I agree with Professor Stressler that we all normally use 10 centimeter because in acute setting, 15 centimeter that increase degree of paraplegia. In our series, the paraplegia is also from acute type aortic dissection. But of course, I think there's multifactorial in acute type A dissection. The spinal cord vessels are not very collateralized, something like that. So it's higher chance of paraplegia. I think if we plan for open second stage, I don't think it matters whether it's 10 or 15 centimeter. And from our series, I think we more keen to use 10 centimeter, in fact.
Yeah, let me just say that I tend to agree with most of that because we've just finished, or in the process of finishing a FDA clinical trial for the Thoraflex in the U.S. We're going to present some of that data in about a month for the early results. And there were 65 patients in there. We had no acute dissections, and we had a few more chronic than chronic dissection as opposed to just aneurysmal disease. And we had 4 patients who had spinal cord issues, and I believe in all of them they had the 15 centimeters, which were implanted.
Because in our series, we did not put any preoperative lumbar drainage. So lumbar drainage was only inserted after the operation.
Our last patient will have 1-year follow-up next month, and so we're looking forward to hopefully getting that through the FDA.
Thank you. Looking forward to the result. First, Ressler.
I think three small comments. One would be that you were talking about the open back door. I think you have to qualify it as saying that it can only happen in chronic dissection. In chronic dissection patients, even if once you put the frozen elephant trunk, there cannot be any backflow because you are measuring the landing zone, so there cannot be any backflow. So it's only possible in chronic dissections. The second would be that I think I would still recommend, once you deploy the frozen elephant trunk, please use the endoscope. It takes 10 seconds to control. The case that you presented, maybe you would have seen it if you have done that intraoperatively.
We've done that.
Waiting 1 week and then being surprised that it was in the false loop.
No, in fact, now, basically, in all our case, we have ultrasound TEE. Basically, we have very competent echocardiologists to look at. The first thing that after we start distal perfusion, I always ask them whether you can see the elephant trunk, the flow between the true and false lumen. And in that case, I truly believe it flips. Because we have created a little bit of fenestration, and then we try to put a 10 centimeter frozen elephant trunk in the true lumen. But you can imagine if the true lumen is very small, and then you have a big aneurysm sac, and the flow is going to push the elephant trunk straight. And then I think it flipped out. Rather than
you made a new fenestration?
A little bit, yeah.
Why? We do that only in classical elephant trunk, but in frozen you don't need to make this. Then either you do a classical elephant trunk and you can do that so that both the lumina are perfused, or you come with a new technique. If you mix it together, you may have such problems. If I'm using a frozen, I don't do any fenestration.
If you don't do fenestration, I think we're going to sew on the sewing cup, right? So the sewing cup, basically we need to introduce the frozen elephant trunk into the true lumen, and then somehow we need a common sealing zone at the proximal. So I stitch at the outer, the true aortic outer.
You don't stitch, that means you're only stitching the outer ring and not the inner.
Yeah.
But I take both, so that the whole idea is to close the entry into the false lumen. If you don't do that, then you can as well do a classical elephant trunk.
Yeah, the thing is, when the false lumen is fixed and the septum is fixed, that actually sometimes doesn't work very well, in my experience.
Not in mine.
Yeah.
Malik, stay there just for a second.